Or good afternoon. Good afternoon, everyone. And thanks for spending some of your lunch break with us. We understand that a lot of people have surely gone for lunch. And I'm sure the room will kind of fill up momentarily. But today, this afternoon, we have an interesting discussion for panel session on a helping hand access of all. It's kind of like a spin-off from the previous section, in case you guys were right here. But this afternoon, I have two wonderful speakers. One, Angela Copeland, Chief Information Officer, Assistant Deputy Minister, Ontario Ministry of Health and Ministry of Long-Term Care here in Canada. I also have Dr. Ishan Majan, who was graciously flown in from the Trinidad and Tobago. He is the Chief Executive Officer, National Information and Communications Technology Company Limited, IGovTT. I love the acronym, by the way. And he was just sharing about his flight experience into Ottawa. Wonderful, wonderful, wonderful. Angela, over to you. Opening remarks.
Sure. So maybe first of all, I'll just say hello to everyone, and very excited to know that this is a theme throughout the conference. And as we know, it was a topic definitely raised this morning by both of our keynote speakers, which I think we know why it's so important. Just in case for the room, I'm from Ontario, province of Ontario, and so that's majority of our offices are based out of Toronto. Ontario is, in fact, one of the second largest provinces here in Canada, with over 100 million square feet. So obviously we have, a majority of our population in urban areas, but also a number of kind of remote areas as well that we need to service. And as a result, a number of kind of different in diversity and vulnerable populations. In my particular role, I'm responsible for about 230 business solutions that service a total of about 14 million people. We have about 61 billion in expenditures, given that our core portfolio includes our Ontario Health Insurance Program. I also support 911 land ambulance, long-term care, our data and analytics support, public health, and then finally the kind of internal ministry operations. But as you can imagine, to support health, I also work with a partner, assistant deputy minister, who sets the strategy for the overall sector. And then we have two main agencies that provide delivery support, being Ontario Health and Public Health Ontario. So all that to say, as you can just imagine, and I know you all deal with this around kind of how fragmented it is in terms of our approaches, the fact that we are still pretty vertical in what we're doing. We have a number of initiatives on the go that unfortunately are still continue to be disconnected. But I think overall we're moving in the right direction, and we really want to kind of make a change in this space. But I really do believe that to do that, it is really around kind of changing the mindset, the culture, and the ways that we do things. I personally have only been with the provincial government for about a year and 10 months, coming from the sector up, and really kind of felt this, firsthand in terms of what needed to happen in terms of going forward. So I think what I'll do is just share some thoughts of my observations of maybe kind of 5 key areas that we have to maybe think differently around this space. I think the first is, I think we're really good at consulting with our stakeholders, and getting public engagement and around kind of what's important to our stakeholders, and make sure that we can approach it in terms of what they need. But it seems to be very much front-loaded, and we don't really kind of spend the time to continue with that journey, because we know that a lot of the work that we need to do takes time. It's incremental change, doesn't happen overnight. And so I think that continued engagement of what are those priorities, how do we prioritize them, are we really representing the journeys and the needs the way that we need to, really needs to change, and it needs to be really that fulsome engagement. The second thing is, I think, around our strategies. And, again, the province has been really great around putting forward, Ontario's first digital and data strategy. We also have a digital first for health strategy in terms of kind of the sector and where we need to go. But we haven't really internally taken the time to think strategically of our own kind of journeys and how we would build in this area. And so just recently, we're really focusing on developing actionable plans that take those strategies down to the next level. And not only are they very specific to, say, a division or a branch or a ministry, but we're looking at working cross-collaboratively with those provincial agencies that I spoke about, as well as our broader kind of GovTech-On, which is our IT-focused area. The third kind of area is really around focusing on that front door perspective. We have Service Ontario that is really our front door for all of our services. They support 20 ministries in terms of services, and there's over 100 type of services that they provide. In addition to that, we've stood up Health 311, which is meant to be kind of the front door as it relates to health. It's starting to think about how those two organizations work consistently, so it's the same experience that our consumers are having. And there's a lot of kind of back-end support and warm transfers. And that, again, that there's the same consideration for providing all the different channels depending on what people need in terms of their personalized experiences and needs and wants and the services that they want at that time. And so, and how do we kind of put in some joint new technologies, like, for example, video verification services, so that, we are kind of leveraging opportunities to provide service in a different way and not having, for example, people, if they don't want to come in, they don't need to come on, or if they want to be digital, they'd be digital, or they come for in-person services. I think the other kind of key area we are really focusing on too is making sure that we do actually mean and stand behind providing equitable, transparent services that are personalized for every person. And so, again, although our initiatives have been very, spotted in terms of investments, and we're trying to kind of co-collaborate on how do we accelerate this forward, we have made, significant strides in, for example, providing remote care management and giving individuals the option that they can either come and get their medical services through video consulting, or that they can phone and provide services, as I mentioned before, and really so that it supports them from having to come in and put a burden, for example, on our emergency rooms. We are also providing kind of remote device connectivity options. And again, if people are not comfortable with that, they don't have to opt into that automatic remoting. They can call in. And then even the broader government are trying to provide those services where people need them most. Just recently, my partner in CIO, in terms of kind of providing digital licensing as it relates to used vehicles, is now we've provided that those services can actually happen when someone goes into a dealership, and they can get their permit, they can get their registration, everything they need just at that place that, for example, that they need that. And then finally, I think the last thing I would say in terms of kind of strategies and starting to think about this is really putting effort towards digital enablement. I think, everybody realizes that, if you develop kind of the supports, whether it be in person or whether it be phone or whether it be digital, there needs to be the extra support of ensuring that people have the awareness of where they can go to the services, that information can be easier, that they can learn and have the literacy to be able to use that. And I think that that's something that we don't really invest enough in. And there's lots of opportunities of how to start to support programs and stand that up so that you can provide that resources and support. And there's a lot of social services out there as well, like, for example, public libraries that can play a role in that, or community centers that can play a role in that. So I think that's kind of really the final piece that I would say in terms of kind of thinking of strategies of what we need to do differently to really make sure that we support this area.
Thank you so much. Ishan?
Thank you so much, and congratulations for being here at lunch. So clearly, this is an important topic for you. I would like to share a little bit about Trinidad and Tobago. If you're not aware, if you go 2,500 miles down, southernmost island in the Caribbean, you'll find us. We have the best carnival in the world, right? So I hope nobody is here from Brazil, but hands down. We've been producing oil and gas for the last 100 years, and that'll play into the story that I'm going to share with you in terms of digital transformation. And we're a twin island state. So we have tourist island, and we also have what I would call the corporate island, the large one. We have a population of 1.5 million, so we're small, 5,000 square kilometers, and very warm and friendly people. So with respect to what we're trying to do, I represent the iGovTT, and iGovTT is part of the Ministry of Digital Transformation. Ministry of Digital Transformation has only been around for 2 years, and I have been around as the CEO for 10 months. So I'm fresh in the job, so I'm willing to learn and to understand from all of the countries here represented. We will focus on 3 things: digital society, digital economy, and digital government. And of course, within that, digital inclusion is important for us. We also have a partner agency, and that's the Telecommunications Authority, that helps with that. So we looked at the population groups, persons with disabilities, age groups, socioeconomic status, and other geographic areas that have difficulties in terms of accessing services. We looked at skills in terms of using ICT, motivation to use the ICT, and then most importantly, the trust. In terms of the digital development dashboard, I'd like to share some statistics with you. We do have 100% coverage in terms of our mobile cellular. So that's a good part of it. We, however, have 83.9% of the population that own a cell phone. In terms of ICT access at home, 81%. But we dropped when you looked at households with a computer, 60%. And therein lies part of the digital divide. When we looked at persons with disabilities, it represents 3% of our population. Around 60% are male and the rest are female. And 60% of that are individuals 55 and over. So that also represents part of the population that we are trying to service. And now we're going to get to the services and the initiatives to be able to help those. So we have things like ICT access centers and community centers. So we are currently building out 100 so that they have not only the ICT access, but an individual there to help, to support for digital services. We have a program called TT Connect. We manage that at iGovTT. And it's 7 locations throughout the country that you could come in with no training, no skill, no ability, and access government services. We'll help you there as well. We also have a program where we subsidize smartphones. It's about 100 Canadian, 150 Canadian. And we expected to do about 2,200 of those as we go forward. We're putting in Wi-Fi access in terms of public spaces, so transport hubs, hospitals, libraries, we're making that accessible. And with respect to our school population, we do have a percent of the population that don't have access to laptops. So in the last 3 years, we've supplied at no cost 18,000 laptops. So that's a little bit of our story, and I'm looking forward to questions. Thank you.
Thank you so much for such wonderful journey you've taken us through in understanding the context behind what your government is trying to do. I want to open, we have just 2 speakers, so we have time to entertain a couple of questions. While you're thinking of your questions, and I would have someone just go around and give the mic. But while you're thinking about the question, the first thing that comes to mind, especially in the context of today's economy, is how do you, in terms of limited resources, oftentimes governments are struggling these days with limited resources. So how do you prioritize which group to focus on, which group not to leave behind with limited resources when you want to scale things so fast? Things might be unplanned. COVID-19 was unplanned. Ability to scale, limited resources, and make sure that you're not leaving anyone behind. How do you balance those together?
Like me to start?
Sure.
So with respect to Trinidad, there's a universal fund that actually it's a bit of a tax on some of the network providers. And part of that is actually focused on the at-risk population. So that's one of the ways in which we fund it from there. And of course, through oil and gas revenues that we have in Trinidad and Tobago, we would fund that through a parliamentary note and then go ahead to do things like the access centers. We're also currently embarking on interoperability and EID. That's new. And again, that's funded from government coffers.
Thank you.
I think in our case, we, first of all, I think we have a joint understanding of kind of who our priority populations are. As many of you in the room, we have a big focus on Indigenous. We have a big focus on racialized communities. We have a big focus on, seniors, et cetera. And so I think the first thing is, recognizing that there needs to be the focus on all these priorities, and that we do need to make sure that we have common strategies and consistent approaches as it relates to them. I think for us, when it comes to funding, the challenge is there is limited funding. And I think, what we're taking now is, rather than trying to really focus on more funding, it's like, how do we kind of work smarter, and how do we look at ways of accelerating our various pieces of work versus just kind of independently trying to tackle each problem. And again, that was something that I was kind of alluding to in my kind of opening remarks, is that, we do think that there's a lot of efficiencies to be had if we work more horizontally as a government, as we all service the same citizens. And I think that's one of the biggest challenge, is that we haven't been able to kind of turn that corner, where we all know that when we look at the government as one government. We don't see the Ministry of Health, we don't see the Ministry of Transportation, we don't see the Ministry of et cetera. So I think, that is one thing that's, especially, I think, a big focus of our Secretary of Cabinet right now is how do we start to kind of shift to be able to do that? And we think through that, we'll actually be able to free up more resources, free up more funding, and then as part of that, hopefully accelerate a lot of our work that we do to be able to support all the priority populations that we serve in Ontario.
Thank you so much. I would throw the questions open. We have a gentleman over there. I want to take a cluster of questions. So please feel free to indicate if you have any burning questions at this time. Just a gentleman for now. Over to you. Yeah.
Thank you. So Dr. Inchan, thank you so much for coming all the way from Trinidad and Tobago. You also forgot to mention great cricketers come from that island. So my question is, I guess, two questions. First, you mentioned the provision of computers and other technologies for the underserved nations. Obviously, first step is provision, next step is adoption and use. So I guess I'm not sure if you have any information or insight on how well is it being adopted and used to, serve the people. And then leads to my second question is, if they're being served and they're being taken care of, who would be the second group on your radar?
Thank you so much. Yes, so Brian Lara is from Trinidad, you're right. And when we looked at the population skill level, we know that 73% of the population are at basic level. So we do have several programs. We have a program called We Learn TT that allows any of those individuals to come in and get digital skills. As you go down, you'll recognize that the more complex, the less individuals. So we're working on that. In terms of the second question was? So that would be the school population, the school age population. That's what we're working on, and that's why we provided the laptops. And there are a lot of programs that we would like to now include in the curriculum to be able to allow them to be digitally smart, coding, STEM as well. You're welcome.
Yeah, thank you so much. Any other questions in the room? So while we're thinking of questions, I'm just going to be, dropping some questions. Maybe that would help facilitate some questions from the audience. Oftentimes, governments can't do this all by themselves. So are there any collaborations and partnerships with private entities that has worked? And can you share any of the success stories or some of the roadblocks in this?
In our particular case, we haven't, as a provincial government, done significant partnerships. We usually rely on our delivery agents. Like I said, in our case, we have Ontario Health. We do provide kind of funding of opportunities for innovation and partnerships and do encourage it. I think that, one of the challenges is starting to try and find out how do you build out those agreements that support that success and enablement in terms of going forward. And one of the pieces I think is starting to kind of really focus on kind of what are the outcomes that we're hoping to achieve, and then working backwards to start to build those agreements where they're incentivized, and when there is kind of that funding, that we're really kind of showing the progression to where we need to be. That really means starting to think about those agreements very differently. They haven't traditionally, I believe, kind of been set up that way, but I think that that'll make the huge difference of going forward. The other area is I think, there's a lot of opportunity with us in particular in terms of working more with our municipalities and with other sectors, whether it be, education, social services, because in most cases it is a lot of the kind of more the frontline organizations that know their communities well, know what their needs are, and can be able to kind of develop the programs to make those differences when it relates to kind of adoption and use, et cetera. So that's all to say is I really think that, again, we're in this juncture where we have to think different about those partnerships, how they're set up, who we start to kind of define and to work with in terms of those partners, and then move forward. We are, again, seeing a little bit of that shift, but I think there's a lot more opportunity to rethink that in terms of going forward.
Thank you. You want to add to that?
So I'll give you an exciting project that we have launched recently called the Developers Hub. And we are actually partnering with the entire private sector to bring them in to help us develop solutions for government problems. So we went and we did a survey through the different ministries, found 5 of the top problems that they had, and we got some funding from the International Development Bank, and that allowed us to do this project. So IDB was a partner in this. We also have the Caribbean Telecommunication Union, the International Telecommunication Union as well, in terms of supplying expertise and advice. So that's an example of looking at a public-private partnership that we're very excited about.
Thank you so much. Wonderful initiative there, I must say, for both governments. I do have room for questions, and I have loads of questions, so I don't want to steal the show. I want to turn it over to you all to kind of ask any questions you might have for our guests. We have Leighton Front and any other person, so I can take them together and we answer them together. All right.
My question has to do with consultations, and you spoke about the fragmentation that exists. That's the case also within the federal government. And one of the things we've been hearing from our stakeholder communities is that they've been consulted, but they don't feel heard. So I'm just wondering, what best practices you've implemented at the provincial level to make sure that folks who are being consulted feel heard, whether it's through a feedback loop or whatnot, so that we could potentially apply it at the federal level too.
Thank you.
We're not perfect either. I will say that. I think one of the things that we've definitely started to see is, especially sector-based, is kind of setting up consistent groups to work with. Because I think one of the challenges is that you can do these kind of broader engagements, and then being able to kind of provide that feedback and opportunity loop is very difficult. And then, as I mentioned, I think the importance of having them along for the journey as you're starting to kind of put those pieces in place are pretty critical. And I think the other key piece to that is there's one thing in doing it in terms of kind of policy and overall kind of setting the kind of priorities in terms of a strategy going forward. That partnership with delivery agents that actually are involved when you implement and start to make it real are pretty critical as well. So I would say I think that is probably 2 key pieces to start to think about. And then I think once that starts to happen, then I think you have more of the opportunity to then do that feedback loop and kind of show the progress and discuss, and build on everything that you've put in terms of putting things forward. But it is very difficult, I think, when you're serving such a big population, is how do you do that? Because otherwise, as we all know, the media will jump in and end up being the ones who will end up commenting on that feedback and how we're doing. So that would be my take in terms of kind of the opportunities.
So some of these statistics that I provided is from a digital inclusion survey. So that's one of the things that we did to be able to get that feedback. We also have 2 TT Connect buses that we take into the rural community, and we get as much feedback as we can, and we also collect through the TT Connect service centers information. We have 177 ministries, departments, and agencies, and we partner with them to also get their feedback because they serve different segments of the population, and they are our major clients. So we collect information there and try to be better. We're not perfect as well.
Thank you so much. We still have room for question. We have gentlemen in front here. We have someone at the back there as well. You can start with. No, yeah, that's closed. Yeah, but you can start here.
From Share Service Canada. So after you get the partnership and funding, I would like to ask the question about the staff recruitment. So how do you attract talents or staff in your organizations? And do you have some volunteers? And what's the proportion of the volunteers and paid staff? How the distribution? And so I'm more asking the recruitment and the attraction for staff. For both of you, yeah.
I feel, does somebody else want to answer that question? Yeah, that's hard. Again, I'm only a year and 10 months in, and I will say this is one of the most challenging roles that I've had in trying to recruit individuals into full-time service into the OPS. I think, being in both the digital and the data space, we already know that there's a shortage of people who are skilled in this area. And the second is, we're not only are we competing with each other in the room, but we are also competing with the private sector that, is not only providing better wages, but is in some cases providing more flexibility in terms of kind of the workspace and providing remote work. What we've started to do is actually kind of reconsider our whole operating model of trying to define, who and what are the kind of core roles that we need to staff up within our organization as foundational to be successful in terms of going forward. And then starting to figure out a whole staffing strategy to kind of support that shift, with the realization that, we will never be able to kind of build a full staffing strategy to be able to, have that kind of high performing, fully staffed team that we would want and desire, and recognizing, as a result, we do need to have a workforce augmentation strategy as well. And starting to think about, with that workforce augmentation, again, what type of roles do we need to augment our staff in terms of kind of those skills that we can't necessarily recruit in to the main OPS. Because I think the one thing, and I would assume is, that we all share in common as being, public servants, is we're all very much here because we're committed to the cause. We have a passion for what we do. And so to find people who have that passion and commitment is I think, number one. Because as I said before, it is very much around, culture, the ways that we're doing things, and thinking about the impact that we want to give in terms of going forward. So that's probably not the answer that you wanted, but I mean, I also just want to be, upfront about it, that this is a challenge that we have, and I think it's one that we just have to accept that that's the environment that we work in, and we just really have to start to think about different ways of how we work within this environment to be successful and move forward on the most important work that we do for the citizens that we support.
Absolutely, I hear you there. You want to share?
So, I mean, Angela has it spot on. It's a difficult proposition. We actually created something called Employ TT, where we have it as a platform to be able to recruit. We have headhunted particular individuals, but the number one point Angela made there was passion. When you are in this room, like you are, and in the public service, it means that you really have to care about the citizens. And we do recruit from the private sector, individuals who want to come across. Like myself, I was private sector and I came across because at this point in my career, I wanted to make a difference. I wanted to impact the citizens. That being said, our salaries are nowhere close to the private sector. We don't have those bonus policies. But what we've been doing at iGov is trying to add value to the employees. So for example, since COVID-19, we're the only organization in the government that maintain work from home. So that is a huge benefit to several of the staff members who have difficulty coming to Port of Spain, which is the capital, traffic and difficulties. So we're working on value add, and we're utilizing those strategies to bring people in. When I started, we had 125 people. In 10 months, we're up to 142. By first quarter next year, we'll be at 175.
Wonderful, wonderful. Thanks so much for sharing. Question on the back.
Hi. So before I worked for the federal government, I used to work for the city of Ottawa, the municipality. And something that we ran into a lot was having a hard time kind of getting the word out about services that were available to people, especially in instances where maybe there are non-government agencies or charities or organizations that are filling in gaps where it's just lower barrier to access things. So I guess I'm wondering if you have any things to share about how we can kind of reach people who need those services, especially difficult when sometimes those people are not yet in contact with us and the services that we provide.
Thank you so much. Marketing and communication of services.
So this one's near and dear to my heart. So I worked in the hospitals, then I worked at a provincial agency, and then I actually went and worked in the municipality at the Toronto Public Library. And it opened a whole new world for me in terms of kind of realizing what the municipalities have in terms of services, what the capabilities could be, what the opportunities are, and how much the municipalities actually truly understand the communities that they serve. Because I think that's the important thing, is that they focus on their community. But I also realized, coming from provincial, what a disconnect there was between provincial and municipality. I think this is another example of that fragmentation and levels of government not working as best as they could with each other. I know in particular with my portfolio, because I've had personally this experience, I'm responsible for public health. One of the things that I've been really working on with my colleagues is, how do we start to work with the municipality public health units and start to think of it more to support them in the communities that they need with the broader provincial strategies. Because I think the other thing is the municipalities could do so much more, but they're bogged down with, like in particular in Ontario, trying to maintain their own kind of digital solutions, trying to wrestle with the collection of the data, all the administrative, can we start to relieve some of those burdens to give them more of the kind of freedom and opportunity of doing what they should be doing, which is providing more clinical care. And I think honestly that most of that, it's just providing the space for people to talk to each other. Like I find that if people just understood and talked to one another, I think a lot of these things could be overcome, because it's not that we don't have enough people and services, we're just not using them for what they're meant to be and broadening. And like that's the same, I'm a big advocate of libraries, given I've worked there. Like anybody who's like, you need to go into a library and see what they do. Like the amount of kind of social service provider that they support. In Toronto, they provide that access to computers to people who don't have computers. Librarians will sit with people and help them to access City of Toronto services, Province of Ontario services, help them, figure out how do they get their health card renewed. Like, and again, it's a whole group of people and who have that trust and relationship with, Betty who comes into the library every day, or Jane who comes in with her family every day. But again, we're not really leveraging that. And I think it's because, and the last thing that I, was saying earlier is, it's that whole shift to focusing on person-centric or, needs to happen. And if you really want to think of person-centric, you need to go and think about where those individuals live every day, who they interact with other day, what the services that they need, and then start to build the support services around it, versus we're so top down in terms of, this is the service we deliver under this ministry, and, everybody will follow this. Oh, but by the way, you have to go over here to kind of figure this piece out. So I do think that shift is happening. It's first happening, I think, I can see it within the provincial government itself. I think the next step will be at then the provincial government working with the municipalities of how to do it. It's starting, but it's just, I think we've got a way to go. It's a bit of an incremental journey.
So we have an interesting case that confused me initially. We were looking at doing something for the older population for a particular service in a particular ministry. We were successful. Yet, they turned up physically in long lines, and we couldn't understand why. So when we interviewed them, they said this is their day out. This is where they see their friends from a long time ago, and they would prefer to do that. So we had it wrong. We thought we're going to be efficient, effective. You don't have to leave your home. You don't have to worry about that. When their thing was human connection. So I think it's a question that we're trying to balance in terms of giving you the efficiency and effectiveness and still having that human connection. So we use TT Connect for that. When they physically come in, they can be completely offline. They communicate the entire amount of services we have within the government. Other than that, it's a work in progress.
I really like their approach because it's an interesting thing. Oftentimes you're thinking about rolling out a certain service, but you don't think about the secondary intention for the users, so the tertiary intentions for the users. So that's one take-home point for me to go with as well. We have just room for 1 or 2 more questions. We have 5 minutes. I have the lady in the middle, just one more question. This is the final boarding call.
Thank you. Thank you for being here today. I was a recent visitor to an ER, and I was very, I had mixed feelings around receiving my results on my phone before actually speaking to the doctor. But it was just kind of fascinating how everything I can remember, a visit to the ER years ago would have been very, very different experience, and I'm okay. But I really loved what you were talking about around being the person-centric. And I think you also used the word compassion, and I'm really loving that you're using these sorts of terms. And my question is more around, you talked about working with other stakeholders and partners. Do you actually go to the universities? Is there any sort of place because, this is a systemic issue, who is making it into med school? Who is getting into nursing? Who is getting into all these fields? You talked about resource shortages, funding shortages. Have you looked at the universities, and how do we select who are going to be our caregivers in the future? Thank you.
I have a colleague right now who's actually accountable for our human resources strategy, and looking at how to kind of build capacity in terms of the province. And you're absolutely right. It starts with the schools and starting to create additional opportunities for not only new med students coming in, and there being more spots for people to actually take their degrees, but also thinking about strategies for internationally trained physicians and clinicians, and how to make it easier for them to practice. And so I'm always not this is the problem being on senior management. I never know what's public or not public yet. Is this confidential? Is it not confidential? But I will say, and there is a number, if they haven't happened already, around announcements to actually start to kind of support those two areas to make the difference in the shift in it. Because you're absolutely right. That's where it needs to start to happen. The other thing I will, kind of allude to too, that we do talk about a lot is it's rethinking the whole kind of primary care model as well, and making access to current physicians a little bit more better, right? There's a lot of tracking of individuals who are actually have a family physician and don't have a family physician, and what are the reasons for it, and how do we start to create these kind of broader networks of Ontario health teams to provide those services for people. Because to your point, when you mentioned going to the emergency room, we do completely realize that the more we invest in primary care, that demand on the emergency rooms will continue to decline. So I think it's a matter of kind of, and this is what the Ministry of Health is doing, is really taking a look at it from every single angle that we need to start to kind of create the capacity that we need in the province.
I think you really echo what's going on in Canada today, not just in Ontario, but across the different provinces. There are a lot of videos out there about people's experience and waiting time of, our emergency room actually taking care of emergencies, or is it the lack of access to primary care that's driving people to the ER in the first place? I have one closing question for both of you. I'm going to start with Asian. Measurements and evaluations are crucial in assessing the impact of digital inclusion initiatives. What key metrics or indicators does your government use to track progress, and how do you use this data to refine and improve your programs over time?
Thank you so much. The Digital Inclusion Survey.
Absolutely.
The most recent one we conducted was in 2022. And of course, we're due now for a survey. We look at the statistics over time, and we match that with the objectives that we have in the programs.
Thank you so much. Angela?
We're very similar. Like, we collect all the kind of consistent indicators that everyone thinks about. I think the one thing that I've been noodling a lot lately, because one of my portfolio is kind of supporting the data and analytics infrastructure, is how to start to kind of translate some of this, what I'll call the lagging indicators that we typically kind of collect of number of access, number per population, to be more outcomes focused, which I think is really difficult to do. And the only way we're going to do it is to be able to think about, like, what is that outcome and what problem are we trying to solve, and move backwards to start the tracking and the baselining now, so that we can actually show that we've made progress in that perspective. So again, not an answer for you, but to kind of build on what you're saying, I think that honestly that is where we need to start to go, because we won't really know that we're making a difference in this area, I think, if we don't start to think about how we evaluate and measure differently in terms of this space.
Thank you so much, everyone. Thank you so much to our two speakers today, two panelists. Really enjoyable. I have loads of questions here, and I hope they've been able to do justice to some of your questions as well. It brings us to the end of this afternoon session. Once again, thanks a lot for spending your lunch with us. I haven't had lunch, and I know some of you haven't either. So thanks a lot for spending your lunch with us. And can we give it up for our panelists, please?